Hi, we're Team Thumos, and we consist of a passionate psychiatrist, technologist, UX designer, and neuroscience researcher. We came together to help millions of Australians identify mental illness relapses before it's too late using smart home technology. 1 in 2 Australians will suffer from a diagnosable mental illness in their lifetime. Mostly, these are chronic, relapsing and remitting conditions, meaning people can go from being perfectly well for months or years to being life-threateningly sick. Patients, carers, and even clinicians easily miss early warning signs of an impending episode. These delays lead to broken relationships, lost jobs, and wasted lives. People have tried to solve this problem by actively logging their progress in diaries and apps. However, most people stop using these apps within a fortnight. It feels irrelevant when well, and just too hard when a relapse is close. At Thumos, we realized that people's wellness can be tracked passively, that is, without user effort, by analyzing how people use appliances in their home. So, we collect data from smart home technology, which, at its most basic, can just be a cheap smart plug sitting between a microwave and the wall socket. That data can give us clues about someone's functioning. Maybe they've stopped using their microwave because their depression is worsening and they've lost their appetite. We can surface this insight to patients, carers, or clinicians to prompt timely intervention and positive behavior change. Before TRAM, we thought clinicians and patients would eagerly use our product to know when to organize urgent appointments and accelerate recovery. After dozens of interviews with a range of people, we realized that clinicians are often overbooked and too overwhelmed to see patients at short notice or manage alerts. They are, however, interested in quick insights about progress between appointments to better target their questions. Patients, meanwhile, love the idea of effortless data-driven insight, but vary widely in what data is relevant to them and what they want done with that insight. Some want their clinicians to know, others want to be encouraged to make changes themselves. We also found that there's a group of high-functioning people that use similar data for reaching personal goals, like doing more exercise or engaging in better self-care. These people are willing to pay for easier ways of tracking and improving their behavior. So, through our interviews, we realized that clinicians and patients generally won't be our first adopters. There are, however, settings where the needs of our two target groups, those with mental illness and those seeking behavior change for other reasons, intersect. There are several semi-independent rehabilitation facilities where those with mental illness learn important self-care skills. This is mainly through formal group training programs, but the staff tell us it's hard to encourage patients to practice skills in their units between sessions and to gauge progress. Our technology could make these facilities much more effective, allowing earlier and more successful transition to independent living. Meanwhile, this use case would give us access to funding and data to validate our product. So, we're now looking to grow our partners and seeking research grants in the mental health rehabilitation area to fund further development and start improving lives. If you'd like to be part of the next steps in our journey, please get in touch. Thanks for listening.